Hi, this is Yazdabul, live from SCAI 2019, and I'm pleased to be joined by Dr. Adil Shroff, who is just going to tell us a little bit more about the best practices. Dr. Shroff, thank you so much for joining us. Tell us a little bit more about the best practices and how basically the update changed from the initial knowledge that we know so far.
Great, thank you. Well, thanks for having me. I appreciate the opportunity. And so this is our Transradial best practices paper. I think in 2013 was the first edition of this, or the first version of this a manuscript that was put out that tried to summarize the sort of the state of the art as well as the literature in terms of what were the aspects of transradial access and closure that we have very good evidence to say that this practice is a best practice, and really trying to help us guide the way this technique evolved and became established in the United States. As you know, from 2007 until now, there's been a really rapid expansion and growth, and it's really by a lot of operators in practice as well as operators in training. And so what we wanted to do is we wanted to try to, at least initially, put together a set of recommendations to kind of give people goalposts to sort of say these are what evidence suggests are practices that we should be doing or should not be doing. And so that was great, and then that worked really well, we think. And so over the past 6 years, there's continued to be a lot of evolution of this procedure and this technique, and so we thought it would be worthwhile to put together an update, and not really a revision. Many of the statements from the initial documents still hold, but now there's lots more of statements and a lot more papers that have shown different techniques that are useful. We focus a lot on ultrasound. We discussed ulnar access. We touch a little bit on distal radial access. So those are some of the topics that we're kind of covering. We're also looking at the role of routine non-invasive testing prior to doing radial access. And so we were lucky to really assemble a lot of sort of thought leaders in this field and try to put together some more recommendations.
Well, what are some of the key takeaways from the new manuscript?
Yeah, good question. So I think one of the things that we really encouraged throughout the document and really throughout this meeting is the role of ultrasound in helping with access. I think even in radial access, there are a lot of opportunities to improve the quality of the care that you're giving as well as the success of your care when you can incorporate radial access or ultrasound in your radial access practice. That's one. I think the other piece that we looked at that I think is going to be a change is the role of routine non-invasive testing, or the Barbeau test. I think we mentioned that it's a good idea to use it to track patent hemostasis, but you shouldn't make access decisions based on the normal or abnormal Barbeau test because there's plenty of studies now that have shown that it's not necessarily predictive of adverse events.
And what do you think this update will mean to the interventional cardiologist and for the patient and basically for the transition of care?
Yeah, great question. I think for the operators, I think it's going to be more details in terms of how to create a practice, how to improve your practice. I think physicians were always looking to know what are the right things to do and what are things that we should avoid doing, and I think we're going to try to help color that a little bit and help give some more granularity to it. I think a lot of times when we talk about techniques, it's very difficult to tell people that this technique is better than that technique. We know maybe one stent is better than another stent, but we don't always know what technique is different, as everyone sort of believes that the way I do it is the right way. And so we wanted to try to help people say, well, here actually is the right technique to do it. And it's pretty novel. I don't think in a lot of other areas that we study the technique that often. And so that's one thing that I think will help. I think it's going to help centers. They're trying to improve the quality of their program. It'll help give them instruction and guidelines in terms of how to help their teams perform procedures better. And I think all of this, the context of all of this, or the underlying assumption for all of this, is that it's going to help improve patient care and improve quality ultimately for our patients. I think all of these recommendations are all about how do we decrease radial artery complications and radial artery occlusion, how do we improve PCI success. So I think ultimately it's all going to lead to better patient care.
Dr. Shroff, thank you so much for joining us. And thank you all for joining us live from SCAI 2019.
Thank you.